by my colleagues, Interim President of New York City Transit, Sarah Feinberg, and Craig Cipriano, Acting Senior Vice President of the New York City Transit Department of Buses and Acting President of MTA Bus Company. As New York City enters Phase 2 reopening today, we are pleased to announce that ridership continues to increase since May 1st. We are now moving 2 million customers on New York City Transit, subways, and buses together. This is a significant milestone and represents a decline on an aggregate basis of 76% from our normal ridership on subways and buses of 7.6 million customers a day. Last Friday, June 19th, bus ridership surpassed 1 million rides for the first time since the start of the COVID-19 pandemic in March. Subway ridership is at 18% of normal ridership. On Metro North, ridership is at 13% of pre-pandemic levels, and on the Long Island Railroad, ridership has increased to 15% of pre-COVID ridership. For those of you who want to follow this in more detail, we're now posting daily ridership numbers on our data dashboard at mta.info/coronavirus/ridership. Our increasing ridership is a sign that New York's careful, thoughtful reopening is gaining steam under Governor Cuomo's New York Forward Plan. Our guiding principle in reopening planning has been safety, as it has been all along throughout the entire pandemic. And the safety of our customers and employees will continue to be at the very core of every action we take as we reopen. With this in mind, the MTA is reimagining operations. We announced our 13-point plan for a safe return back on June 8th in conjunction with the Phase 1 reopening of New York City. And we're strengthening it during Phase 2. It begins with mask, mask, mask. It's this simple. You must wear a mask or face covering when riding our system. That's the law as a result of an executive order issued by Governor Cuomo. The MTA has masks available in subway stations as well as across the Long Island Railroad and Metro North system for those who need them. Our plan also includes increased service. We're running full service on subways and buses with the overnight closure from 1 a.m. to 5 a.m. in effect. I'll let Sarah Feinberg and Craig Cipriano share those details shortly. On Metro North this morning, we added additional 12 east of Hudson trains, 2 in the morning on the Harlem, Hudson, and New Haven lines, and 2 in the afternoon evening on each of those lines. The railroad has moved up the departure time of 3 early morning Hudson line trains to accommodate those employed in the construction trades who tend to travel earlier in the day. Long Island Railroad continues to be at 90% of regular service and is monitoring ridership closely and will make adjustments as needed as well. Our historic disinfecting regime continues across the system as well, and our customers are seeing the difference. Our effort is a huge undertaking made possible by the heroic men and women of the MTA who have never wavered in their commitment to keeping New Yorkers moving and safe throughout the pandemic. Our workforce has our unending gratitude and appreciation, along with the rest of New York City. Today, we also released a new global practices report from WSP and a Johns Hopkins professor acting as a consultant to WSP. The report and its release signal our commitment to continuing to innovate at every turn as New York reopens and we recover from the COVID-19 pandemic. We're leaving no stone unturned in our efforts to ensure customer and employee safety. All of these efforts, however, are only possible through a robust partnership with the federal government. The MTA is facing financial calamity. I can't be any clearer than that. We have drawn down approximately 73% of the CARES funding included in the federal government's first relief package. We expect to exhaust all remaining CARES funding next month in July. We can't afford to wait and urgently need action and leadership from the Congress. We're asking the United States Senate to act and to do what their colleagues in the House of Representatives have done and pass a coronavirus relief package that includes an additional $3.9 billion in funding for the MTA that will allow the MTA to cover COVID-19 related operating deficits in 2020 to help us get through the end of the year. That funding is absolutely critical. I'll now turn it over to my colleague, Sarah Feinberg.
Thanks, Pat. I think the most important thing that I wanted to highlight is our ridership numbers that continue to go up. So hugely gratified that on Friday we hit 2 million total riders, including more than 1 million on buses. Most important thing is for riders to remember that we're doing everything we can to keep the system safe and clean and putting as many tools in their hands to do their part as well. So similar to in phase one, we've got masks in every station. So masks are absolutely required to be in the system. If you're over the age of 2 and you're physically able to wear a mask, you don't have a disability that prevents you from wearing one, you are required to wear a mask. If you forget your mask or drop it or break it, we have masks in the station booths for you. We also now have hand sanitizer throughout all of the stations. We continue to have personnel in the stations, our own personnel, but also we're partnering with the city. The city has continued to give us hundreds of personnel who are in our stations, and we're grateful for their support. They are handing out masks and sanitizer and generally welcoming people back to the system. Our disinfecting and cleaning work continues 24/7 in the system all day, every day, and all night, every night. Cleaning stations, disinfecting stations twice a day, hitting all of the cars that are in service 4, 5, 6, 7 times a day. Many of you heard this last week and the last 2 weeks, but I'll repeat it again. Many of our riders now were not in the system throughout the pandemic. Of course, we continued to carry essential riders, but we've now got a bunch of folks back who haven't been in the system since March. And by and large, what we're hearing from them is that the system has never been so clean, that they feel safe in the system. You know, as you enter the system for the first time, there's a little bit of anxiety. People are dipping their toe in. They see how clean the system is. They see how clean the trains are. There's sanitizers, there's masks, there's everything else, and people are entering the system with confidence. So once again, incredibly grateful to the team of MTA cleaners who are doing such great work, and pleased to see riders coming back. Pleased to be in phase 2 and excited to see what ridership is like the remainder of the week. Craig Cipriano.
Thank you, Sarah. Craig Cipriano, Acting Senior Vice President, New York City Transit Bus, and Acting President, MTA Bus Company. So I'm pleased and so very proud that New Yorkers are returning to buses in a significant way. As the chairman just mentioned, last Friday, June 19th, we carried more than 1 million riders for the first time since the pandemic began. To be more precise, we carried 1,033,000 riders. 1,033,000 riders. Our ridership is still down by more than 50%, but it is rising, and we expect to break the 50% threshold soon. Accordingly, normal service levels have been restored in the Brooklyn, Bronx, Queens, and Staten Island since June 8th. Today, we are increasing service on 4 Manhattan Select bus service routes. That's the M15, the M23, the M34, and the M60 to 90%. As a result, Manhattan overall will be at 80% of normal weekday service. And we are ready to do our part to welcome more riders back as New York City enters phase 2 reopening. The chairman just mentioned unprecedented cleaning and disinfecting, and I have to say the buses have never looked cleaner than they do now. Even in the word sparkling comes to mind. Even the word sparkling comes to mind. We wouldn't be able to do this without the hard work and dedication of our bus operators and all the workers behind the scenes who make buses operate day in and day out. And I am incredibly grateful for their dedication, and we are doing everything we can to keep them safe. Rear door boarding remains in effect at this time. We are providing the highest level of personal protective equipment to our operators, and we are working on a permanent solution to keep our operators safe that we will have more on in the coming days. Our workforce is truly the heroes who have been moving our heroes of New York City throughout this pandemic. And with that, I'd like to turn it back over to Chairman Foy to answer any questions.
Questions? Clayton.
What did you guys get out of the WSP Global Practices report that you couldn't get from doing your own in-house research? And why couldn't you reach out to Johns Hopkins by yourself?
We hired WSP and a consultant from Johns Hopkins, Michael Bloomberg School of Public Health, because they did the report for APTA The report, I think, is incredibly important and valuable to us as an agency, to our customers, and it reports on best practices around the world, not only from transit agencies, but, for instance, the American Society of Civil Engineers in the cooling and ventilation business, and the work by Dr. Rivera, who was a consultant to WSP on the report. Provides, just waiting for the bus to move along, provides significant value to us as an agency and to our customers. Please. I'm sorry, give me that again. Yeah, exactly. Well, at 2 Broadway, we're taking temperatures of everybody who enters the building. By the end of the month, there will be portals with thermal scanners, and we are considering it absolutely. Andrew. Look, the rear door boarding was put into effect to minimize contact between bus operators and customers, and it's actually covered in the WSP report as one of the best practices. That was done in consultation with our union leadership, who felt strongly, as did we, that it was the right thing to do. I'll let Craig address the plan going forward.
Sure. So one thing we recognize in regards to, keeping, New Yorkers moving is, sustainable bus service for the future. And one thing we learned about the pandemic is part of that is, protecting our workforce. So really it's a balance between providing more space on the bus for customers, collecting fares, and making sure that our workforce is healthy as we move ahead. So we're working feverishly to get a solution that balances all 3 of those, and we'll have something to say in the coming days in that regards. So, right now we're carrying 1 million customers. So, it's somewhere in the neighborhood of $1 million a day. So the average fare is somewhere in the neighborhood of $1.35.
David.
Yeah, so in terms of the WSP report, are there any of those things you can say definitively now you're going to do in the next few weeks or months?
Well, look, a number of them, David, we have put into place in March, April, or May. There are some recommendations. The thermal scan is one. The suggestions on pressurization and ventilation, which we're also looking at. The piloting on the ultraviolet C, the far ultraviolet. And the report lists a number of things that we're already doing, some things that are being done at other transit agencies, and as we said, everything is on the table in terms of minimizing public health risks to our customers and employees.
If I could get a follow-up,
Yeah.
just for Craig, is there any, maybe you can answer this, is there any plans, given the interest in the bus right now, is there any plans to procure more buses in order to meet an increased demand? I know we're not there yet, perhaps we will be in phase 3 or 4.
Well, look, there's a significant part of the capital plan is a bus procurement, and there's no plans to buy buses in the short term, if that's the question. Yes, sir.
Have you gotten any results back from the pilot program using ultraviolet?
Yeah, we sure have. About a month ago at Corona Yard, we announced with Dr. David Brenner, who's at Columbia University Irving Medical Center, that ultraviolet C light eradicates the COVID-19 virus. That was the first time that had been confirmed, and it was an announcement that came out of an innovative collaboration between Columbia, Dr. Brenner, and the MTA. The answer to that is yes. First, the ultraviolet C was piloted on subways and buses and continues to be piloted on subways and buses. And that day we announced that the plan, if it worked out well, and it has, the pilot would be expanded to Metro North and Long Island Railroad. Yes, please.
If you don't get a second round of federal funding, even though the region is reopening, what kind of consequences might you have?
Well, look, the effect on our operating budget this year is estimated by McKinsey, midpoint of their estimate, to be $7.7 billion. That is as a result of the ridership decline and the reduction in fare revenue and the decline in economically sensitive or transaction-based dedicated taxes and subsidies that have been put in place by the legislature over a period of years. That is the 7.7 or the 3.9 that we're seeking. We can't cut our way out of that, and the federal funding is absolutely essential. And as I said before, not getting it would result in a fiscal calamity. Andrew.
Yeah, so even at the height of the crisis and the depths of ridership, there were instances of, specific cars, trains, moments of the day where you could not get 6 feet, 3 feet, 1 foot of social distance, right? Because people tend to travel at the same times. That's one of the reasons we've reached out to big employers and big companies saying, please stagger your hours, stagger your workforce coming in. If people can avoid 5 to 7 in the morning and 3 to 5, 3:30 to 5 in the afternoon, that will be hugely helpful because those are the times when we're going to see the most crowding. To answer your question about specific locations, we're keeping a close eye on it, and we monitor crowding reports every single day, and we look for trends, and so we're gonna keep watching that. But we are maxed out on service. We will continue to shift things if we need to. We can move things around. We've shifted some bus service from Manhattan to the Bronx. We'll continue to be able to do that. But, there are only so many ways we can play this. At some point, we're maxed out. So the most important thing is if people can avoid those rush hours, those peak times, and mask vigilance. That'll be the most important thing. Okay.
With restaurants reopening, are you concerned that all these people who may be working late shifts will be now left hanging by the overnight shutdown?
You want to speak about the alternative services?
I mean, look, the subway has now been closed from 1 to 5 overnight for 6-7 weeks at this point. But to be clear, we're a 24-hour operation, so we run really good bus service overnight. And so I think people will be well served by that bus service. And when we get through the pandemic and can add subway service again, we will. But I think for now, they'll be well served by bus service.